Herniated discs versus bulging discs. What's the difference? The discs are shaped like a jelly donut with a hard outside called the annulus fibrosus and a soft inside called the nucleus pulposus. Now, with a bulge, that nucleus starts to bulge out a little bit into the annulus, but not all the way through. Once it's gotten all the way through, it's called a herniation or a protrusion. So a herniation is really just a bigger version of a bulge. Now, the good news is in neither case are you very likely to need surgery for it. By the time you get to be about 50 years of age, about 60% of people without any pain at all have a bulge in their discs. And that number just gets larger as you continue to age. Now, a herniation is only about 36% of people without any pain. So those are more likely to cause you pain, but you still aren't likely to need surgery for them. In most cases, having back pain is actually not a good indication for back surgery. Unless you're having trouble with your bowel or bladder function, for example, you can't hold it or you just can't go no matter how hard you try, or if you have leg weakness that's getting worse over time. Otherwise, if you just have garden variety back pain, you're probably not going to need surgery. And in fact, most surgeons will tell you that I can probably fix your leg pain, but I can't guarantee that the back pain will go away. So what do you do to get your back pain and or leg pain to go away without needing surgery? Well, it's pretty common sense, really. You just do more of the things that make you feel better and less of the things that make you feel worse. The classic herniated disc is thought to hurt more when you do forward bending or rounded positions like this, like bending forwards or sitting down in a chair for a long period of time or driving in the car for a long period of time. But the older you get, the less likely those bending or flexion positions are to bother you, and the more likely straight positions in extension are likely to bother you, even if you have a bulging disc or a herniated disc. So how do you tell what type of treatment is better for you? Well, again, do more of the things that make you feel better and less of the things that make you feel worse. So if you stand up right now and try a couple tests, we'll help you figure out which one of those things may apply to you. So if you just stand and stand at rest, take note of how you feel. Do you have any symptoms in your back or any symptoms in your leg? And then bend forwards as if you're going to touch your toes. Just go as far as you can comfortably. Don't cause yourself to hurt any more. But if you do notice that your pain gets either any better or any worse with bending, then that gives you an indication as to whether or not bending is good for you. If bending makes you feel worse, then you probably aren't going to be good with bending positions. If bending forward makes you feel better and kind of relieves your pain, then you probably want to do more bending activities. Now, bending and standing can sometimes be painful just because you have to activate your muscles. So there are other ways that you can do bending. For example, laying on the floor and pulling one knee or both of your knees up to your chest. And take note, does that make you feel better or does that make you feel worse? And again, if that feels better, do more of that. If that makes you feel worse, do less of that. You can also do bending from a chair. If bending from standing is painful, but you have trouble getting on the floor or getting back up from the floor, you can also try bending forwards in a chair. And if this makes you feel better, doing forward bending stretches sitting down like this may be a good option for you. If it makes you feel worse, then don't do that. So let's say that you do feel worse in bending positions. What would you do instead? Well, you also want to check the opposite direction of motion. So if you're standing up and you lean backwards, then maybe you try doing that a few times. Does your pain get any better as you do that? Does your pain get any worse, or does it stay about the same? If that makes your pain better, then do that throughout your day. Stand up and lean backwards, particularly if you have an office job where you're sitting for long periods of the day. Standing up and doing some of that backward bending motion may be good for you. If you sit for long periods of time during your day, then putting a towel or a lumbar roll behind your back may be helpful to help keep you in a little bit more of a back arch position. Now, there are other ways that you can do backward bending movements as well. For example, one common exercise is doing a press-up exercise like that. Now, you do want to be careful when doing these because a lot of people will hinge from the lowest part of their lower back at L4, L5, or L5, S1. And that's the area where herniations are most common. And so you want to try to move more from the upper areas up there and move evenly throughout all the segments in your lower back so it creates a smooth arch rather than just hinging from the lowest point on your back. Now, what do you do if you find out that neither of those things are helpful? Well, there are other things that can affect herniated discs as well. For example, the discs are designed to bear compression of your spine. But if the disc is herniated, if the annulus has broken down and the nucleus is bulging out, that compression can cause the disc to further bulge and can create more pain. So you probably also want to avoid things that create excessive compression. Carrying heavy backpacks, lifting heavy weights, those things can all create more compression on your spine. Conversely, hanging from a pull-up bar or stretching on a chair like this can kind of help decompress your spine. And if that feels good, again, do more of the things that feel better and do less of the things that feel worse. Now, if you do have a bulging disc or herniated disc, it is also a good idea to get professional help. Seeing a physical therapist who specializes in back problems can help you figure out, one, what's causing your back pain, two, what you can do to relieve it, and three, how to keep it from coming back in the future. If you happen to be in the St. Louis area, we'd be happy to help you out with that here at More for Life. And if you're watching this from somewhere else, but you found this video helpful, give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.